How to restore your neck curve using a device that you can find on Amazon. This is one device. This is about 30 bucks on Amazon, and it has 3 different levels that we don't have to keep repurchasing different levels every time you need a new fitting for your neck as your neck starts to develop and adapt to those curves. So here's what we're doing. We're placing this in the neck, and the way this one is, this isn't as specific as some of them out there, but this one is a great place to start. It has a curve here that helps fit right into the middle of the neck. So we naturally have these curves in the neck and the low back, which are actually very similar. They're actually the same type of curve, which is called a lordotic curve. Basically, the curve goes this way. You can kind of see how it wants to curve that way. Same thing with the low back. You're going to start developing these curves. The neck curve is really important, though, because this is the first one that really starts to develop in infancy. As a baby starts to lift its head up, look around against gravity, that curve starts to develop. What happens, though, is we sit and we're looking down at our phones and computers, essentially our sedentary lifestyle, we start to lose that curve, and then we start noticing all kinds of random stuff, symptoms of headaches, which could be tension-based headaches, dizziness, problems with just tightness and pain in different areas of the neck. You'll notice if you rub right up through here in those suboccipitals, those will probably be tight and irritable and inflamed, because again, if this starts to straighten out, or what we call a reverse neck curve, if you're doing an x-ray, traditionally chiropractors look for this. They're going to look for that, is your neck starting to curve? That could be a big problem, right? So essentially what we want to do is we want to start to restore the curve. It's kind of like braces for your teeth. You want to actually get into this with a 2 to 3 minutes the first time, kind of assess, see how you do. If you have any dizziness, any symptoms at all, just stop doing it. Okay, just get off the neck device, and consult with your doctor or whoever gave it to you before proceeding with it, because we don't want you to get worse, right? So it is a specific thing. There's specific protocols to use. Everyone's a little bit different with their neck curve. So again, ideally though, this is what's going to happen. You're going to put it right in the neck, laying on your back. So I'm going to demonstrate for you. So for this, I might start off with just level 2 on here. I'm going to basically be laying completely flat. Make sure your legs are down. Why don't you kind of come over here, Megan? We're going to place, and some of them actually you'll see, like it'll say shoulder side. So you have to place the shoulder side towards the shoulder, so it points down. And if you get into this position here, it works best to just kind of curl your chin up. So you're doing deep neck flexion exercises already, which is great. And that helps to actually stabilize your neck. So I'm basically curling my head up like this, tongue to the roof of the mouth towards the top front of the teeth in the back there. I'm going to slide this all the way in till it's snug, because typically, in most cases, I'm going to start with putting that in the lower to mid cervical. And you can't really go too far off with this, because your neck in this type of device, it's going to feel good in certain areas. It's not going to feel good in others. And the whole idea here now is my head, my skull, touching the ground? Is it lightly touching the ground? And do I feel, and now I have to adjust this a little bit, do I feel some pressure going into the middle of my neck? And I do. Does it hurt? No. Is it not super comfortable? Yeah, it feels kind of like if you're pushing into muscle, kind of like almost like a mild trigger point. That's okay. What you don't want is, oh, I feel dizzy, I feel lightheaded, I feel like that's creasing this pain, it's starting to be sharp pain. That we don't want. But if it feels mildly uncomfortable, but something that you could just lay here for 15 to 20 minutes if you wanted to, then that's probably a good spot for you. Okay, so now what we do is we just focus on hands on the belly, just taking some deep breaths. 4 seconds in through the nose. And then if you have good breathing through the nose and your sinuses are open, then try to do nose breathing. So in 4 seconds, and then exhale for about 8. Through the belly, relaxing the neck muscles, and really just trying to relax on your exhale and kind of sink deeper into the device, so your neck can start reshaping its curve. Now, the way to get off of this, and again, start with maybe 3 minutes just to assess it. The way you want to get off of this is you want to kind of support yourself here. Bring your legs up, because that will already kind of decrease the tension in the neck. And then start to kind of bring your chin up, and you can assist your head on the back of your head. And then you're just going to kind of roll to a prone position. That's going to basically help you to not, it's going to be, your neck's going to be more loose and unstable when you get off of this thing. For the first 3 to 5 minutes, it's not going to become super unstable, but if you have weak muscles, what I don't want to see is this. You're getting off like that, right? You don't want to jut your head forward, because that's going to pull, and that can give you some problems in the neck right off the bat. Now, when you start working your way up, you want to work up to about 15 to 20 minutes a day, and it should be comfortable. There shouldn't be, again, any of those symptoms. Now, when you work up to that 15 to 20 minutes, if you're to try to do that right off the bat, which I highly not recommend, you're going to create a lot of instability in the neck, because up to about 20 minutes creates what's called creep, which is essentially when the ligaments in the joint really starts to kind of become more elastic and flexible, and it starts to stretch. But that's kind of what you want, but you want to build that over time. It's like braces. You're not going to just crank on your teeth with braces. The dentist or the orthodontist is never going to just crank on it until to the exact position you want your teeth. It's going to be very incremental. Same concept with this. 20 minutes a day is what you're trying to work up to. Keep track of this, keep track of your symptoms. And then of course, if you're seeing us, let us know what those are so we can walk you through. Always safety first with this kind of thing, because you're inducing actual structural change to your neck. Now the benefits of this are gonna be great. Like I've had people that were having headaches that go away. Like just after the first session, you might feel like this flushing sensation as you get up, just because now the neck is able to kind of be in the right position to allow the pumping mechanism in your upper neck, which is a pumping mechanism as you breathe. What that does actually helps get cerebral spinal fluid from your spine in and out of the brain. And a lot of times that stuff gets trapped up there from not moving well up here. So again, the sacrum and the upper neck has a pump mechanism. When you breathe, it's pumping cerebral spinal fluid in and out of the brain. So this can feel just almost like a flushing effect, and you can feel, again, a whole lot better just by doing this initially. But then as you progress, you're going to get better and better. And then actually, if you've had an x-ray now and you see like, oh, my neck's all jacked up, then you're going to see like over time, you're going to get structural change. I do recommend doing this with a chiropractor trained in things like chiropractic biophysics. That's a specific technique that really deals with this on the most specific level. So if you have any questions or concerns, please let us know before you kind of undertake this type of regimen. All right, thanks guys.